So humanistic medicine, अगर मैं बहुत ही simple words में किसी को समझाऊं, तो it is what the essence of medicine is actually about, compassionate
Hmm.
medicine.
Hmm.
जहाँ पे when you are dealing with your patient, you are doing so with empathy and compassion. So we're all sitting, we're doing our work. I'm doing the paperwork, cut work our house officer is supposed to do.
Hmm.
She comes in, she sits down on the bunk bed, has her head in her hands, and she goes like, मुझे लगता है मैं फर्श छोड़ के नफिल अदा कर रही हूँ. And Rufetta is basically the name of the first female surgeon and nurse of Islam. And it's about, and the reason I chose that name was because it was about the first female one.
Hmm.
They wanted extra favors, and I reminded them that, you haven't even paid 50% of the price and everything. And they were like, thank you for reminding me I'm poor. And I was like, that is the epic example of what gaslighting looks like.
Okay, Assalamu alaikum everyone. I hope you're doing well. This is your host, Dr. Amara from Women with Steths. I'm excited to welcome you all to yet another episode of Women with Steths, where we bring stories from women in healthcare and medicine. So, without further ado, let's start with the introduction of our guest for today. We have with us today Dr. Arfa Masihuddin, who is a physician, a lecturer, and a startup founder, along with being a doctor. She is the founder of Profeda, a platform dedicated to mental health of physicians. And she also owns Walking Thoughts, which is a mentoring startup where she mentors individuals in written and spoken English and ERAS applications. Along with that, she is also a senior lecturer for health and hospital management at the Institute of Business Management. With her long list of achievements, she's truly a girl boss, and we're so happy to have her here with us. Welcome to the show, Dr. Arfa.
Assalamu alaikum, and thank you so much for having me with you today, Amara. That was a very kind and generous introduction. Happy to be here talking to people who are very focused on women empowerment, especially in a field as challenging and demanding as medicine. So happy to be here.
Thank you so much. So let's start, this podcast, or we will be starting with, the most cliche question of all time, which is tell us a bit about yourself. Where did you grow up? How did you get to be in medicine? Where did you graduated from? How was your med school like? That journey.
So it's a very interesting question because I really don't know where to tell about how my med school journey began. It was something like kind of, just came thing
Mm.
very naturally. But if I were to give you in one sentence, tell you about myself, then I would say I have this tagline on my blog also, the heart, the soul, the stethoscope. So I've always been very passionate about writing and combine that with medicine is how everything that I do comes about. And so,
Mm.
starting from the beginning, I grew up in Karachi. I was born and raised here, and I'm the eldest of two siblings, both of us girls. So, I think the girl boss thing kind of naturally came in or something. But yeah, we had a very fun childhood, very close-knit family,
Mm.
doting aunts and uncles and grandparents with a lot of emphasis on education, you know, um, education as well as extracurriculars like reading and writing,
Mm.
all those things, public speaking, all of those things were greatly emphasized upon in my family while we were growing up. And there was
Mm.
no restriction as to about which field you should be taking. I think that is the reason I ended up doing so much experimentation, so many experiments with my career,
Mm.
shifting from medicine, dabbling into writing, spoken English, all of these things. So that's how it came about. And since I always loved writing. I had my own blog. This is when back in the days when WordPress was a huge deal, when Instagram
Yeah.
was not a thing and it was all the days of just Facebook and WordPress and all of that.
Mm.
So I had my blog at WordPress and it was fun. I used to enjoy writing. And from there, it eventually love for writing started growing. And I ended up asking my parents to let me take up English language in A levels instead of the GP paper.
Mm.
And I did, even though it was very challenging because I already had sciences, and along with that, I had A-level maths also. So an English language subject on top of that was like five subjects, and all five that requires work because this English language was not like GP. It was not just essay
Mm.
writing. We literally had to
Mm.
dig into the linguistics and
Yeah.
analyze the text and everything. So it was fun, and I ended up getting a distinction across Pakistan in that, in
Oh,
AS.
mashallah.
So I was like, for me, that came as like, okay, see, I told you I'm good at writing. Now I am. I have something to prove it. So that was really encouraging for me. And
Hmm.
that is why, when I came in med school and later on also, I continued to write on my blog, and
Hmm.
very much so.
Hmm.
So how I came into medicine is, I think there was no set, like nothing specifically behind it, no great story behind it or anything. I was just good
Hmm.
at sciences. I enjoyed
Hmm.
biology, and it was like
Hmm.
being set. Some of those things I feel like now that I look back, it sounds like something very predestined for you, because I am a firm
Hmm.
believer of destiny. So I feel like it
Yeah.
was just meant to be, and when it was meant to be, things just started happening, and I ended up where I
Hmm.
was. So I graduated from Ziauddin University in 2019, and while I was there, I joined the literary society there. I was the editor, and then finally the chairperson of the literary magazine as well. So when my third year of medicine started, and our clinicals began, as you would also know, third year में usually clinicals आपके start हो जाते हैं, rotation start होती
Hmm.
है. So I always found myself drawn more towards the patient interaction. Everything the
Hmm.
patients were feeling, what the doctors were experiencing, that led
Hmm.
to my interest in humanistic medicine. At
Hmm.
that
That's so nice
point,
to hear.
yeah, and it was that branch of medicine, you could say, that nobody talks about, because you see, it's like medicine
Yeah,
is supposed to be about healing, right? You're supposed to be
exactly.
helping people. So the altruism factor is already there. So what do you exactly
Hmm.
mean humanistic medicine? Because
Hmm.
that part has been lost now.
Very
A
true.
patient comes into you, you listen to them, you prescribe medicines, you let them go.
Very true.
Where
Very
is the
true.
art of listening to their history really? Where is the empathy? When you're treating a patient respectfully, when you are listening to their entire story, when the treatment
Hmm.
that you're giving to them is tailored around their individual needs and their
Hmm.
circumstances also. That doesn't happen anymore, unfortunately.
Hmm. Yeah.
So at that time, I had a professor, Dr. Ijaz Vora, who in fact recently passed away just a couple of days
Hmm.
ago.
Hmm.
And under his guidance, when I interacted with him and I told him about my interest, he was very, very supportive. He was really supportive, and he really encouraged me to take up humanistic medicine later on. And he would
Wow.
always share resources, books, and articles with me regarding that. So I think if
Hmm.
there was a turning point to where I am now, that's where it began. And I owe this to him,
Hmm.
because no, honestly speaking, no other professor ever took it seriously.
Yeah,
They
I
were
mean, that's
like,
so
this is just
refreshing to
fluff.
hear. Yes.
They think it's just, it's just there, and it's not real stuff. Real stuff is all
Hmm.
science. It's happening in the lab.
Hmm.
The research
Hmm.
papers you're
Hmm.
writing. ये तो soft
Hmm.
सी चीज है ना, तो इसके बारे में
Yeah.
तो बात करनी नहीं है. It's
Yeah.
not fair to do that. So that's how I began writing, and writing about
Hmm.
medicine. So that's how I delved towards narrative medicine, basically.
Hmm. Hmm.
And what I used to do basically was just write about my experiences in the clinic. Patients coming in, things I'm noticing, things that are wrong, acute patient interaction, or how the doctors' lives are, things like those. Every rotation, at the end of every rotation, there would be a blog post on my Instagram or on my WordPress about it. So taking that, the interest was already there. Then when I did my house job, that was the COVID year. So,
Hmm.
it was like during COVID, everything just came up. Everything that was wrong with the system came up.
Yeah, true.
All the flaws, everything was just
Yeah.
exposed. I use
Yeah,
the
it
word.
was like a
So,
mirror.
seeing that, so I realized that what I should be doing is maybe become part of the system that makes the system, the policy makers and everything. Maybe I
Hmm.
could start a change there. My policy was always
Hmm.
like my philosophy was always that if I can't do anything to change, if I can't, change anything, there is no point about it. I might as well just give it all up. And if I'm just going to be a
Hmm.
part of it and go on complaining and complaining like everybody
Yeah.
else, not fair, not
Yeah.
fair at all.
Very true.
That was an insight. And then I lost my maternal grandmother, my nani, when I was in my fourth year. And she went through a very long period of illness. And during that
Hmm.
time, I was with her all the time. got to see up close, while being a medical student, both sides of the story, the patient and the
Mm.
provider. I saw
Yeah.
that what the patient's demands were, how the providers were unable to, accommodate that,
Yeah.
what their limitations were, and what the patient's limitations were. And I think
Yeah.
that was a second step towards pushing me towards where I am right now. And that's when I
Mm.
realized that a lot of things are missing in our system, and empathy being most of all, the
Very
biggest factor.
true.
So after house job, I came across this advertisement which was put up by the Aachen University, and their department, the Critical Creative Innovative Thinking CCRT, it was led by Dr.
Mm.
Asad Mia. I found it to be very interesting, and I applied for it, and I got in, and that was the final call, because once inside, I got to know that there are so many ways I could contribute to the field of medicine, having all the clinical knowledge that I do. And while on, we got to rotate in different departments, we got to see different things. We had a good know-how about public health also. And at that point, entrepreneurship, human-centered design thinking, which I'm a great fan of now. So then I applied for my master's in health policy and management. And I got in, and Alhamdulillah, for my first year, I also got a scholarship over there. And when I graduated, my thesis was about basically exploring the organizational factors that are affecting the well-being of healthcare providers, basically.
Oh.
And the entire aim was that, once, so if you go back a little, you'll see that I recognized humanistic medicine is delivery of
Yeah.
compassionate care. But in
Yes.
order for a caregiver to be compassionate, they need to have
Yeah.
the system, the tools to
Exactly.
support them, to enable them to do so.
Exactly. A hundred
Just how we
percent.
say it takes a village to raise kids, similarly,
Exactly.
it takes a lot for healthcare providers to be able to deliver that. I mean, you cannot expect an underpaid and overworked healthcare provider to be
Yes.
compassionate to the people
Very
coming in.
true. Yes, very true.
Yeah. So then I was like, okay, let's go back. हम human centered design thinking अगर apply कर रहे हैं, तो my for empathy lies with the healthcare providers. They need to be empowered
Hmm.
first. They need to be
Hmm.
supported first. And that was the entire concept, the entire philosophy behind wanting to have a thesis on that. And the
Yeah.
results were not surprising, but
Yeah.
shocking. Not
Yeah.
surprising,
I
but
can.
shocking. Because I realized that there is a huge gap here.
Hmm.
uh, Mental health हो, चाहे उनकी professional development हो,
True.
system organizational factors जो हैं, leadership, all of that needed to be supported.
Yeah.
And it all took me back to this one fine day of my house job, जिसमें there was this resident who was a second or the third year resident in the gynecology department, and it was my gynae rotation, and she just comes into the room. So we're all sitting, we're doing our work. I'm doing the paperwork, scut work our house officer is supposed to
Hmm.
do. She comes in, she sits down on the bunk bed, has her head in her hands, and she goes like, मुझे लगता है मैं फर्श छोड़ के नफिल अदा कर रही हूँ. And I'm just sitting there trying to make sense of what she's saying, completely clueless. The other doctor just looks at her and says nothing. 2 minutes she sits like that, then she wraps up her files and walks off. And I asked the other
God.
doctor, I was like, ये क्या था?
Yeah.
She's like, इसके दो बच्चे हैं. Her elder one is 2 or 3, and the younger one is a few months old. And she leaves them and comes here and does the work. So that's taking a toll
God.
on her now.
Yeah.
And I think that moment, was
Hmm.
why the feather is here today. And that is
I'm having
why
goosebumps.
that
I'm having goosebumps right
I
now.
still remember
Yeah.
it. It's been so many
Yes.
years. Yeah, it's been so many years to that. I mean, this was the COVID era
Hmm.
when this happened. So that is why I wanted to conduct my thesis on this topic.
Yeah.
And based on the results of my thesis, I co-founded Rufeda with my
Hmm.
sister, who is a Richmond graduate from IBA. And together we have Rufeda Care for Healthcare, and which our entire aim is to make healthcare service delivery easier by empowering the healthcare providers, be it in mental health, or offering them workshop and sessions on how they themselves can build up a better support system at their
Hmm.
workplaces. And
Yeah.
we're aiming to target the higher ups, the CEOs, the leadership also, so that
Yeah.
they are able to form a culture that facilitates
Yes,
that.
exactly. That was a lot of, I would say, insightful plus inspiring. And I have so much to, comment on, starting from your journey from before med school and how you told, you used to dabble in a lot of different things. You used to experiment a lot, and that has contributed to your journey of, n- choosing a field or going for something that is just unknown, especially in Pakistani healthcare system. And I am so, so, so happy about the fact and about the reasons that you started Rufeda with, especially because ये जो terms है ना, humanistic medicine, holistic medicine, or narrative medicine, these are just unknown terms. And I can say with a surety that, even while many listeners will be listening to it, a lot of people will not have heard this term before.
Yeah.
This will be the first time that they will be hearing this term. And what surprises me always is the fact that this is so interlinked with the clinical medicine and the everyday medicine, yet so ignored and so less known about. And starting from the experience ke, even though it's a very altruistic field and it's a very compassionate field and everything, the whole concept of medicine is being humanistic. But when we see in actual, the humanistic factor is not there. Especially when we see for, the junior years जो होते हैं, जो training के years होते हैं, या जो junior doctors की जो time होता है, उस time में that stuff is not there. Because और उसकी वजह से ये होता है कि जब उनको वो चीज़ नहीं मिली होती, their glass is already depleted. It's not even half full, it's depleted. They're running on minus energy. तो वो कैसे, how will they be able to, transmit the compassion that is required of a healthcare worker, and this has to come from, it has to like trickle down from from up to bottom. It cannot work if जो juniors हैं, they are working or they are trying to do something, but जो healthcare management है या जो the higher ups हैं, they have no idea about it. So it's such a the chain is so interlinked and so complex. And while I was listening to you, Dr. Arfa, I was just so, what do I say, so relieved, so happy, so inspired even, because as a junior doctor myself, I know where exactly you're coming from, what exactly, the experience that you shared about the female resident in gynae ops, where she, broke down. And what surprised me was not, or really resonated with me was not just her words जो उसने कहे कि मैं फर्ज छोड़ के नफल अदा कर रही हूँ. What really resonated me or hit me was the reaction of the other resident who saw all of that and did not do anything. And I can picture it all very very completely. So to know that you not just identified that problem, but also give in very little words, gave a damn about it and did something about it. It's just very, very inspiring. And I'm so glad you did that. And I cannot wait to hear more about Rufeda, especially, and of course, about walking thoughts as well, because एक और चीज़ इस एलिमेंट में ये भी है कि when we think of doctors, तो we think of, एक ही तरह की इमेज हमारे जहन में आती है कि वो लैब कोट पहने होंगे, वो हॉस्पिटल में पेशेंट से इंटरैक्ट करे होंगे, वो ज़रा सूखे किस्म के होंगे, ड्राई किस्म के होंगे. The creativity part is not really linked with doctors or the field of medicine. And even जिनमें होती भी है creativity, they just lose it somewhere along the way because of how
They don't have
grueling the
time.
entire.
They don't have
Exactly.
time. And then the creative juices, all the empathy, creativity comes from
Yes.
empathy, right? That is skilled.
Yes, yes. And so it's so interlinked because जब वो एक part kill हो रहा है ना, तो साथ साथ उसके साथ जो interlinked part था, which was empathy, that is also getting depleted. So it's so interlinked. All of those factors are so interlinked with each other. So I am just, I cannot say it enough how happy I am to hear all of that, all of your journey, and all of what led you here, and especially, the contribution from Dr. Ijaz Vora. That was very refreshing to hear because I cannot picture, especially, a doctor, a senior doctor, I would say, who will be,
Absolutely.
willing to listen to a medical student and even
An
be
HOD,
supportive. Yes,
person, head of
exactly.
clinical affairs. You'd
Yes,
never imagine someone, paying attention to a
yes,
mere medical student for that, listening
exactly.
to them and encouraging them. I
Yes,
mean, this is all a ripple effect. You see the
yes,
impact
so
of
so true.
mentorship. A good
Exactly.
mentor, they can change lives.
Very true. They can change lives and multiple lives, not just your life, but the lives of multiple people that
Absolutely.
will be associated with you from there on. And to एक चीज होती है एक मेडिकल स्टूडेंट को किसी क्लिनिकल चीज पे सपोर्ट करना. एक चीज होती है जो वो बहुत एक अलग
उनकी
चीज के
विजन
बारे
में
में बात
सपोर्ट
करे.
करना उनको.
Exactly. And they saw through the vision, along with you, at the time that it was not, maybe even materialized. And that is a huge thing. That is a huge, huge thing. And it was so refreshing. I would say that again and again. It was so refreshing to hear this whole story and how, each step led to another, how all the puzzle pieces came together to, create the bigger picture. And I'm just so happy. That is all that I'm going to say. And I really, really, really hope that this goes on to create ripple effects, for, years to
Hopefully.
come. And especially the part about policy changing and the part about changing. Okay, एक होता है कि यार आप उसी सिस्टम में हैं and you're complaining about it, you are ranting about it, which is all right. I'm not saying कि rant नहीं करना चाहिए. मैं खुद बहुत rant करती हूँ. I'm not saying कि वो नहीं होना चाहिए because
That's your
you
way
need to
to
vent it
escape,
up.
right? That's your coping
Yes.
mechanism.
Yes, you need to vent it out. But there is, no point if you're just renting about it or not doing anything about it when you reach a position where you can do something about it, which is what usually happens to, I would say, 90% of doctors. They go through this entire process, they have this entire grueling medical school years and house jobs and training, and then they finally get to the position where they are a position of authority, when they have in them to do something, to change something. They are just so numb or insensitive or just so hardened by that time that they don't care. They're like, okay, I went through it. Everyone goes through it. You have to also go through it.
Exactly. 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 This
And
reminds me of something that one of our admin people in the hospital said, and I would not want to quote it here, but it was, but
I'm sure.
I was, if I hadn't, I'm so glad you said it, because if you hadn't, I would have probably said it. देखिए मसला ही यही होता है कि भाई हमने भी तो सहा था ना. What is the big deal?
Yes,
Can't you do the
yes,
same? No one's willing to.
exactly.
And my analogy, my philosophy is always that, okay, if this was your real biological kids, wouldn't you
Yeah,
want to change things for them? Isn't that why you're working hard day and night to provide them with a better life? So if you can have the same sentiments and feelings for your children, what about other people? Where does your humanity go? Where does the
yeah,
altruism go out of it? मतलब
yeah.
मुझे लगता है हम ग्रेजुएट करते हैं तो ही उस सारी एम्पथी को और उस चीज को छोड़ के आ जाते हैं, जब बड़ी बड़ी बातें कर रहे होते हैं कि ओ इंसानियत की खिदमत करेंगे, ये करेंगे, वो
Hmm.
करेंगे. Once you step into it, you lose it. And I don't
Yeah.
blame the junior doctors, honestly, because what goes on, the higher ups, I think
Hmm.
it's not hidden. Either whether it's the
Hmm.
public sector or the private sector,
Yeah.
we
Very
know
true.
how things work. And it, it's just a really sad state of affairs down there. And no, the problems, nobody's willing to change it even. Because
Yeah.
while we were working on Rufeda, we've had a couple of workshops already. One of
Hmm.
them was also on effective communication. And again, that stemmed from my walking towards experience, which I'll tell a bit about later. But all of these things, whenever you're trying to reach out to the hospitals of to offer them these things, they fail to see the value in it. They fail to
Yes.
see they will make their employees happy. If the employees are happy, the employees will stay. And
Yes.
then we complain about brain drain. We complain about shortage of
Yes.
nurses. Obviously, if the nurses are getting paid somewhere else, why will they not go? They also have a family to
Exactly.
feed. Not
Exactly.
everything is about doing things for free and welfare and all that.
Yes.
Yes, it is there, but you have to find a balance, a healthy
Yes.
balance, in order to make sure Rufella is based on the philosophy that put on the oxygen mask first on yourself. How
Hmm.
can
Yeah.
you go on to do CPR on someone if you yourself are struggling to breathe? And that is
Yeah.
what the entire healthcare system all over the world, in fact, is standing on.
Yeah,
It's
very
such
true.
a sorry state of affairs over there.
Very true.
In based on the same things, what Rafeda right now currently is doing, and I think you would be very interested in that also, is that we're working on publishing a book with IGI Global on the topic of impact of organizational culture and the
Mm.
well-being of healthcare provider. So I
Wow.
am one of the editors, and along with me, Dr. Minhaj Kidwai, who is a big name in quality assurance in healthcare. We're the editors, and this we've just started collect, the call for chapters for this book. The reason being different perspectives से जब हमको opinions आएंगे, perspectives आएंगे, that what are the problems people are facing in terms of organizational culture, and how do they think they can be solved. And
Hmm.
as we know, this is the world of data. Everything that is data driven, research endorsed is what comes up more than your sentiments. So
Yeah,
that is
very
entire
true.
purpose of why I have started taken the initiative of writing this book,
Hmm.
editing this book. Basically, it's a compiled chapter book, is so that there is some literature out there. The more we talk about it, the more we raise voice about it, the more work we're going
Exactly.
to get done. And this
Exactly.
book is also under the banner of both Rufeda and Walking Thoughts. Walking Thoughts because it's a literary organization, and Rufeda because that's the work basically that we're doing.
Hmm. Yeah, that's so true. That's so very, that point about it needs to be talked about, it needs to be discussed for the value to be seen. और जो आपने बात की ना कि when you go to the hospitals and the higher ups are just not able to see the value in it because that this concept is just so alien कि क्या मतलब health care के लिए mental health, what is that? Even mental health concept in it even in its basic form is so in its nascency in our culture. So when we, bring healthcare and mental health together, that is again, something that just blows your mind
Yeah,
कि अच्छा ये क्या हो रहा है, ये किस बारे में बात हो रही है, ऐसा भी कुछ होता है, डॉक्टर्स को तो सिर्फ काम करना होता है ना, डॉक्टर्स को, हेल्थ केयर वर्कर्स को तो, they just have
exactly.
to work. And that point about which we started from कि ये जो word है ना कि ये जो sentence होता है कि we did it, so you also have to do it, we went through it, हमने किया था तो सबको करना है. And मेरा उसमें ये point होता है कि just because something is done the way it is does not mean that it is the correct way and that something else cannot be done or some better way cannot be done about it. It's just that we don't care enough about that. We do not care enough कि are the healthcare workers even happy की बात तो बल्कि शायद बाद में आती है. Are they even content with where they are? And every other healthcare worker that you talk to, they will be they will be expressing their dissatisfaction in one way or another. They will be venting, ranting, etc. and everything. And I think I can go on and on and on this, but let me put the brakes on this right now. And I will ask you, what is the meaning of Rafeda, and what is the logic behind the name?
Rufeda is basically the name of the first female surgeon and nurse of Islam. And it's about, and the reason I chose that name was because it was about the first female one, first
Hmm.
female to
Yeah.
nurture, and also who spoke about humanistic medicine, and it was a very nurturing nature.
Yeah.
So Rufeda का concept ही यही है, care for healthcare. So,
Hmm.
on if you were to put a hierarchy for all those who care, तो उसमें we're caring for the healthcare workers, the people who
Hmm.
are out there caring for everybody else.
Yeah.
That is why Rufeda.
That's
So,
so
and then
thoughtful.
again, she was the first female. So the in Islam, first surgeon and nurse of Islam. So is वहाँ से आया था, because I wanted it to be something that also represents me and my sister, both
Yeah.
of us being females, of course, and
Yeah.
someone starting off that thing, that whole legacy. So that is why it just hit home. So yeah.
That is so thoughtful. That is so thoughtful. Um, I would also want to know a bit more about what do you mean by humanistic medicine when you talk about it?
So humanistic medicine, अगर मैं बहुत ही simple words में किसी को समझाऊं, तो it is what the essence of medicine is actually about, compassionate
Hmm.
medicine.
Hmm.
जहाँ पे when you are dealing with your patient, you are doing so with empathy and compassion. ठीक है, empathy and compassion in the sense कि आप उनकी तकलीफ को ना सिर्फ समझ रहे हैं, but you really want to help them, and you are kind in doing so. Basically medicine that is kind, not the
Yeah.
medicine. अगर if I have to give you an example, it would be a patient walks into the clinic of a doctor, a very busy doctor, who does not even look up from his desk and goes like, हाँ क्यों आए, क्या मसला है, क्या हुआ था आज, कैसे आना हो, क्या तकलीफ है? बोलेंगे डॉक्टर साहब ये मसला है, ये है, वो है, जोड़ों में दर्द है, वो। हाँ तो आपकी तो उम्र हो गई है ना, मतलब 60-70 के तो आप हो ही गए होंगे। अब इस उम्र में नहीं होगा तो किस उम्र में होगा? छोटे बच्चे को तो होगा नहीं। ठीक है, दवाएं लिख के दे रहा हूँ, हो जाएगा। 2 minutes का भी
Yeah.
कंसल्टेशन। एंड दिस इज
Yeah.
कॉमन, यू नो दैट, आई नो
Yeah.
दैट, दिस इज
Yeah.
कॉमन।
Yeah.
व्हाट
Yeah.
इज ह्यूमनिस्टिक मेडिसिन? अस्सलाम वालेकुम, खैरियत, कैसे आना हुआ आज आपका? अच्छा ये तकलीफ है, नहीं मैं समझ सकता हूँ बिल्कुल, कि आप समझ सकती हूँ बिल्कुल कि आपको कितना मुश्किल हो रही होगी, इससे चलने फिरने में मसला हो रहा होगा।
Hmm.
आपने अभी
Hmm.
तक कोई दवाई इस्तेमाल की है इसके लिए? नहीं।
Hmm.
अच्छा अच्छा, ये बताए आपकी वैसे दिन भर कमल कितनी मूवमेंट कितनी होती है? सीढ़ियाँ चढ़ना उतरना तो नहीं होता? मतलब आप एक्टिव हैं या नहीं है? वो बोलेंगे नहीं, मैं जैसे अपने ग्रैंड चिल्ड्रन को स्कूल लेने जाता हूँ, पैदल चल के चल जाता हूँ, मस्जिद चला जाता हूँ, तो इतनी मूवमेंट है। चलिए, तो बहुत अच्छी बात है कि आपकी इतनी मूवमेंट भी है, हर हरकत में बरकत होती है। लेकिन जो आपको दर्द है, मैं बिल्कुल समझ सकता हूँ आपको कितना मसला हो रहा होगा इससे। तो ऐसा करते हैं कि मैं कुछ दवाएं आपको लिख के देता हूँ और कुछ टेस्ट करवा लेते हैं इसके। तो ये कि ये जो मैं टेस्ट लिख के दे रहा हूँ, उससे पता चल जाएगा कि नमकियात की कमी है, विटामिन डी की कमी है, क्या है। फिर देख लेंगे अगर उसकी आपको जरूरत पड़े दवाइयों की, क्योंकि मैं आपको फजूल की दवाई नहीं देना चाहता जिससे आपकी पैसे भी ज़ाया हों और वो आपको असर भी ना करे। उसके अलावा ये कि आप दूध पिएं, थोड़ा आराम करें। ठीक है, इंशाल्लाह हो जाएगा, इससे बेहतरी आएगी। और मुझे पूरी उम्मीद है कि अगली बार आप मेरे पास आएंगे तो आप बोल रहे होंगे कि डॉक्टर साहब आज मैंने ना सिर्फ मस्जिद तक गया, मैं आज पार्क भी हो गया। डू यू सी द डिफरेंस इन हाउ आई एम
Yeah.
टॉकिंग?
Yeah. Very true.
That is
I
what
can,
humanistic medicine is.
yeah,
How
I
long
can
does it
imagine
take?
it. Yeah.
How
So
long
very
does it
true.
take? 60 seconds of compassion in the way you're talking to someone.
Yeah.
That is
Yes.
all. The
Yes.
way we phrase our words is
So
so
true.
important.
So
मतलब
true.
हमको
So
सब
true.
पढ़ा दिया जाता है, गाइडलाइंस बता दी जाती हैं, प्रोटोकॉल्स बता दिए जाते हैं मेडिसिन में। लेकिन व्हेन इट कम्स टू द आर्ट ऑफ टॉकिंग टू योर पेशेंट, वो तो करते करते आ ही जाएगा। करते करते नहीं आता।
Exactly.
हमारे पास
नहीं
अच्छे
आता है.
एग्जाम्पल बिल्कुल भी नहीं है। एंड इंटरेस्टिंगली इनफ, लाइक दिस इज व्हाट आई काइंड ऑफ ऑल्सो डू एट वॉकिंग थॉट्स, बिकॉज जब वॉकिंग थॉट्स मैंने स्टार्ट किया था, it was in when I was in third, fourth year of medicine, and it started with spoken English classes for doctors,
Hmm.
especially the female doctors, because मुझे ये realization हुई थी कि people do not know how to talk in a formal setting, इस तरह
Yes.
की उसमें भी, and even in the professional setting, because I would come across so many people who were so good at the work they did, had so much knowledge, they just
Hmm.
did not know how to put themselves out there, how to converse. And unfortunately, English
Yeah.
is the universal language. So when I recognized that gap,
Yeah.
I started giving spoken English classes based on the fact that I had a distinction in English language and I could write and I was good at public
Hmm.
speaking and
Hmm.
everything. So that is how it started. And you wouldn't
Hmm.
believe me, Dr. Amara, the people who were coming in from private tertiary care hospitals, the
I'm
doctors who
sure.
were coming to me. And I would give one-on-one classes. And it's we still do that. We're still giving those classes. Now I have a team of
Hmm.
teachers, and their classes were customized in a way that they would feel more confident in in their professional settings. मतलब हम mocks, conference and poster presentations इस तरह की चीजें करते थे. And from
Hmm.
there, we eventually delved towards ERAS consultancy, personal statements and
Hmm.
CVs and all of that. And usme bhi majority of the people who were coming in, I realized that it's good when they want to write it out in a story, but what they're
Hmm.
coming in with, they've already lost it. And they haven't even
Hmm.
started their clinical practice yet. They're just so burned out completely. So
Yeah.
I feel that both of my ventures are towards the same thing, about making better doctors, I would say.
Hmm.
Doctors who are a bit more kind, who are a bit
Yeah.
more compassionate.
That is just again very heartwarming to hear, and that is something that I myself very strongly feel for, and in my capacity try to advocate for as well, that doctors especially do not know how to talk, which is just surprising and ironic because this field is about interacting with people, and if you are not able to talk to them, if you're not able to just be human enough to them, then what's the whole point of being in a field where you're easing someone else's pain? And iska, again, it has a lot to do with how the whole structure or the whole system is designed कि कभी हम इस चीज़ पे बात usually नहीं करते. And speaking of, kindness and compassion, it's also linked with, we will also be talking about medical ethics. Ethics हमारे, especially in our Pakistani system, सिर्फ मुश्किल से शायद सिर्फ एक मॉड्यूल होता है, या शायद वो भी नहीं होता,
हाँ,
कुछ बहुत सारी जगहों पे, एंड
बहुत
दैट्स
सारी जगह
इट.
नहीं होता।
That's it. That is the whole interaction of ethics with a healthcare worker, that has to go on and literally deal with human lives, and that is, I would say, alarming. The number of and the intensity कि हमारे जो healthcare workers हैं, and especially I will be talking about doctors here, उनको नहीं पता ethics क्या है, उनको नहीं पता कि वो जिस तरह से patient से deal कर रहे हैं वो सही नहीं है. You cannot brush off a patient, or you cannot, बहुत छोटी छोटी एग्जांपल्स हैं which I myself also see regularly, and that really irks me. And it again has to do with how, अगर हम उसको back step करें, तो again it has to do with how this was never prioritized in the whole system to make better doctors. And to make better doctors is not just about instilling in them the clinical the clinical knowledge or the clinical
Yes.
acumen. It's also about how they are as human. And if by the end of it you're not a good human, to चलो ठीक है, आप अपने पेशेंट को ट्रीट कर रहे हैं, आपके हाथ में अल्लाह ताला ने शिफा भी रखी है, आपकी ट्रीटमेंट बहुत अच्छी है, यू आर वेरी गुड एट व्हाट यू आर डूइंग. But if you're not talking to them nicely, if you're not behaving with your colleagues nicely, what is the whole point? What is the whole point if you're not a good human being by the end of it? And I can go on again, like I said, I can go on and on about this, but I also know that I will be, amongst the very few who will be giving some care about this. This is also something that needs to be talked about, even though everyone is affected by it. Especially the people who are
Yeah.
not able to give that compassion, they are, I would say, the ones that are most affected by it, और उनको पता भी नहीं है. And especially what you talked about, we don't know how to talk, or doctors don't know how to talk or to formulate their thoughts. That is true. It's in, especially in the professional settings. जैसे आप ERAS की applications, you will be able to comment much better on this. But even simple कि आपने एक email कैसे किसी को approach कैसे करना है, you cannot just. I know I hit a nerve there. It's
Yes, you
just
did. Because you cannot just be like, send me the document. Please send.
exactly. Yes,
Okay.
yes,
Okay, thank
introduce
you.
yourself. Yes,
कुछ नहीं
sometimes
है, कुछ
not even
नहीं
that.
है. Oh my God,
Sometimes.
Dr. Kumar, you won't believe the kind of people I have come across in the last 3, 4 years I've been doing this consultancy business. It has irked me so much that my mental health had been affected.
Oh
I
God.
mean, every season I go like, okay, this is the worst season, and the next season again surprises me because the kind of people I come across. And I am like, if I was the program director, I would never do it based
Yes.
on the simple factor that there are no ethics in you, the way you're dealing. Unfortunately, हमारे पास ये समझा जाता है कि if you have paid somebody money to do,
Hmm.
you own them. हालांकि ऐसा नहीं
Yeah.
होता. You are paying them for their experience and their expertise. You came to them for a certain reason, and you have to respect that. If you cannot, then you
Yeah.
might as well not come. I mean, once I had this person, so unfortunately, I have become known as a sort of person in the market who will give you a lot of discounts. I literally had, can you imagine people coming in 2 days before the deadline, the submission deadline,
Hmm.
and expecting me to write a personal statement? How am I going? Because we have a whole process on how you do that, and the entire reason I wanted it to
Yeah.
do, because I
Yes.
realized that it's not their fault if they have the skills, they have the knowledge, they just
Hmm.
can't write. What is their
Yeah.
fault? Because how do
Hmm.
you assess somebody based on a piece of paper in which they're trying to tell their story? जब उनके पास skills नहीं है, उनके पास knowledge है. So it's not fair.
Hmm.
So that is why I
Hmm.
wanted to delve into this, and I was like, okay, I'll use my writing skills to help them. And now, Alhamdulillah, I have a great team who has been trained to do that. And I just do the admin work and the excuse me, the proofreading work. And they're the ones who, do the things.
Hmm.
This one person comes to me 2 days before and says, You know, I had an epiphany while I was on the Janemas, and and then I came across your page, and I knew that you would do it just because I write a lot about spirituality and I write about these things. They automatically assume that maybe this is how we should get into her, and oh my God. I was like, okay. I just did not reply because I did not know what to reply. We close our
Yeah.
registrations 1 month before because
Mhm.
we take 10 days to write the for the entire process of writing, so it's not as possible to do that. Then there was another person that came in because I gave them a
Hmm.
discount. And bhai, ek to maine the number of discounts I've given have gotten me into trouble. Because then everybody comes and expects that, and then it's not fair on my writers whom I have to pay.
Hmm.
So, it kind of messes up. So this time I was like, okay, no discounts. We'll just have a very strict policy. We'll keep our price as reasonable as we can, but no extra discounts given to anyone. So this
Mhm.
person comes in and asks for a major discount, which is given to them. And then they have some issues with the work. And I go like, and there
Hmm.
was a lot of back and forth because even if someone, because obviously it's creative work, so it's not necessary that the other person is going to be satisfied with what you've written for them. So I'm always open to revisions and how we can make them better. And I always ensure that
Hmm.
jab tak they're not satisfied, I'm not going to leave their case. So,
Hmm.
even that argument, and they wanted extra favors, and I reminded them that, you haven't even paid 50% of the price and everything. And
Hmm.
they were like, thank you for reminding me I'm poor. And I was like, that is the epic example of what gaslighting looks like. I'm just
Yeah.
telling you that that
Yeah.
I don't owe you these services, and this is what you're telling me. And it surprises me because, doctors हैं ये तो पढ़े लिखे लोग हैं. They're the top
And these are
tier
people who are preparing, these are people who are preparing for
for
the
an
USMLEs.
international
Yes.
USMLE, people who are preparing for, I mean, how do you, and सारा मसला mentality का है अमार, because हम पाकिस्तान में है ना, पाकिस्तानी कंपनी है तो करेंगे. If we were a US
Yeah.
based company, they would dare not do that. And
Yeah. Yeah.
sometimes I've
Yeah.
also felt it's also been because I'm a female. And if
Hmm.
this was
I'm
male,
sure.
they would have done that. तो उनको लगता है बहुत आसानी से कर सकते हैं.
Yeah.
And
Yeah.
me being me, it takes such a toll on my mental health that
Yeah.
I don't know how to handle these people. मैं इनको कैसे समझाऊं कि ethics कुछ होती है,
हाँ,
professionalism
बिल्कुल.
कुछ होता है. Out of the
Exactly.
blue, they will message you or call you at 11 p.m. in night, and you'd be like, working hours होते हैं, कुछ decent hours होता है. I mean, I'm not sitting in a clinic or an emergency
Hmm.
department that you come into me whenever you want
Yes.
to.
Yes.
हर जगह पे एक अपना decorum है,
Yes.
but
Very
no,
true.
no, just
बिल्कुल.
won't do that.
Yes.
You
Again,
definitely hit a
it's,
nerve
when
there. Oh my
you
God, I could go on and on about it.
I'm
एक
sure because
एथलीट्स की
that
भी क्लास होनी चाहिए for our people.
I know. And that reminds me that we also, would like to talk about walking thoughts in, in its own zone. What exactly are you doing? I know, but I would want my audience to know as well. What exactly do you do with that? And what is the structure like?
So, Walking Thoughts is basically an online literary organization, you can say, where we are offering spoken English classes for everyone now. Initially, it was restricted to doctors, but now we're open to everyone. And what we do is we offer group classes also, but in a group, there's not going to be
Mm,
more than 5 people, so that individual attention can be given also. And then we have individual one-on-one classes. Now,
mm,
the frequency of the classes depends on the student's proficiency level. तो हम उसको assess करते हैं
mm,
and फिर बनाते हैं. Every course structure, it's not like we have the same course outline for everyone. It depends on
mm,
their current level of English, and it also depends on their profession. So, for instance, if a doctor
mhm,
is coming into us, which is what we specialize in, तो जो हम उनको spoken English exercises करवाते हैं, those are based on role playing related to their
mm,
professional lives, mock presentations and everything. And then we guide them about everything कि ये ऐसे ऐसे आप बोल सकते हैं. These are the different ways and how which in which you say this thing. And क्योंकि medicine में काफी technical terms भी होते हैं, तो उसमें they kind of mess up their grammar and stuff. तो हम उसकी भी उनको करते हैं. So this is what the spoken English
mm,
is about. उसके अलावा we do university and college applications as well as ERAS. तो
mm,
उसमें होता है कि उनकी पूरी जो application होती है CV and their personal statement that उसका एक हमारे पास set format है. उसमें we have a detailed interview with the candidate. There's a whole set of questions they have to answer.
mm,
We understand them and we get it
mm,
written. so that we can gauge what their writing style is like, so that it's closer to that, right? And then based on that, we come up with a draft, we discuss it with them. Once they approve it, we go on to writing. And Alhamdulillah, we've had amazing
Hmm.
results so far. uh, we've had success rates from Johns Hopkins, also from Harvard MBA, or where our personal statements got accepted
Hmm.
and the students got in, and a very good success rate
Hmm.
with ERAS also. Where so many of our clients got interviews and they got selected.
Mashallah, mashallah. I'm so happy to hear that. And I'm also very happy to hear, how you formed the whole structure of Walking Thoughts. And this is a very, very personal statements and ERAS applications, specifically speaking, मैं doctors वाले आपकी branch की बात कर रही हूँ. That is something that people very really struggle with, and they are always looking out for ways to do that, because again it also has, again हर चीज़ हम जब backtrack करेंगे तो it will link to something else, और वो उसका link यही है that doctors specifically are not really taught or given this thought कि expressing themselves in a non-clinical way is also
हाँ.
an important part. They're never taught that. So वो जो lag है that really does show when doctors have to fill in applications for online sorry international exams, and when they come to this part कि अच्छा personal statement वो क्या होती है, उसमें क्या बताना होता है, और that is where that comes in. And I'm glad that you are doing the work that you're doing, and mashallah, mashallah, you are doing so well with it. You have a whole team with it, and I really wish you all the best with it as well. Okay, so you were talking about, Dr. Arfa, you were talking about how Rafeda and Walking Thoughts, both of these contributions of your work came at a juncture where you wanted to, teach people about it too. So tell us about that. How did that came
Yes.
about to be?
So that came about when I got an opportunity to work at IOBM, Institute of Business Management, as a senior lecturer for their health and hospital management program, MBA basically. And all of these things culminated here at the teaching experience, because you see, everything that we were trying to do at Rafeda,
Mm.
humanistic medicine, organizational culture, I had the audience right here. Future healthcare managers, administrators,
Yeah.
hospital CEOs, all the people pursuing an MBA in health and hospital management.
Hmm.
So
Hmm.
this is how it came about, and my teaching experience at Walking Thoughts, teaching adults from a young age, all of that, culminates here. And when I get a chance to, be it on, I've taught leadership also, I've taught health service delivery and operations management also, I've taught quality management. Every time I'm teaching, I realize more so myself how much that is linked to humanistic medicine and how much improvement we can bring about in the organizational culture. So getting a chance to do that with my students, I think it's amazing. It's a dream come true, because that's how I get to see how I'm actually able to inspire my students, how I'm actually able to show them the other story side of the story as well. And Alhamdulillah, for having great students, for having a very supportive administration, for a very supportive the department that let me tweak my lectures in a way where I'm incorporating the humanistic element also, and getting a good response from my students, who then go on to deliver such things at their workplaces, and then they come back and tell me, give me feedback that, oh, we started this initiative and we're getting such good feedback for that. So that's how I realized the ripple effect of things, how it comes to place, and it's just very satisfying then when it
Hmm.
comes to the work.
That's so, again, so heartwarming to hear, because as teachers you are able to influence in a very different way. You are हर मेरे ख्याल से हर काम का अपना बहुत अलग एक impact होता है. And
हाँ.
when it comes to teaching, the profession of teaching, I think why it is such an important profession is because teachers are the one who can literally shape your thoughts. Just like, you mentioned about your mentor as well and how
Yeah.
he shaped your journey. I'm so glad to hear that you thought in this direction as well, which is very, I would say, unusual too for a doctor. क्योंकि जब हम डॉक्टर के बारे में बात करते हैं तो हमारे अगेन हमारे जहन में टिपिकल पिक्चर जो आती है वो क्लिनिकल मेडिसिन के
clinical medicine.
एस्पेक्ट में आती है. अगर हम एकेडमिक मेडिसिन अगर अगर हम एकेडमिक साइड की बात भी करते हैं तो फिर वो यूजुअली हमारे पास आता है क्योंकि you will be teaching basic sciences or clinical sciences, but you will be somehow linked with MBBS or BDS in some way. But this field, healthcare management, it's such a different one for a doctor specifically to be choosing. How was that like when you decided to share it? I'm sure your family would have been supportive, but how was, in general, the observation, sorry, the, what would I say, the reaction like? Okay, you are a doctor, you have studied for so many years, you have worked for so many years as a doctor, and now you are somehow shifting to a very layman, to a very layman's eye, even though I understand that how all of that is linked, but to a layman it will be like, you're shifting your field कि आप teaching की तरफ जा रही हैं. How was that like?
So, to be very honest, there was no such resistance from my immediate family, which means my
I'm sure.
mother, father, my sister. They were very supportive and they've always been. So, for them, it was like, okay, if she is doing something, she must have thought it through. She knows what
Hmm.
she'll do, she'll be fine. So, it was just that. And they literally have been extremely, extremely supportive in everything. No
That,
questions asked. They were like, अच्छा तुम कर रही हो, तुमको कुछ सोच समझ के करी होगी, you know what it means. And every time it paid off because when I got the scholarship at AKU, in fact, when I graduated, I also got their Global Student Award for Excellence and Impact and Innovation based on Rafeda and the work that I was doing. So when they saw that, okay, there's something there, it just makes them more happy. But
um,
no questions were asked. Like honestly, I'm
hmm.
not even joking. No
I'm
questions
sure,
were
I'm
asked.
sure.
But as far as the other the extended family and everything, they were curious because they were like, but why? What is this?
Yeah.
क्या रही हो तुम? So
Yeah.
I used to try to explain it to them by saying कि आप ये समझें, I'm trying to teach doctors how to be doctors. And then they still wouldn't get it. And I was like, okay, fine, let's talk in a few years. I would just cut the
Hmm.
conversation short because I'd be like, if
Hmm.
I was like, I'll just show it and I'll do it and I'll show it to you rather than this. Because वही बात होती है कि आप डिग्री क्यों जाया कर रहे हैं क्लिनिकल करके, अगर आपको क्लिनिक्स में
Yes.
नहीं जाना. सर डॉक्टर तो वही होता है जो यू नो मरीजों को चेक कर रहा
Exactly.
है.
मरीजों को देखता है. हाँ.
हाँ, मरीजों को देखता हूँ. एंड आईड बी लाइक, लेकिन वो मरीजों को देख जहाँ रहे हैं वो भी किसी स्ट्रक्चर पे बेस्ड है, राइट? वो स्ट्रक्चर प्रोवाइड करना इज माय जॉब. एंड इफ आई
Hmm.
हैड नॉट हैड माई, एंड अगर ये बात आती है कि हाउ इज योर एमबीबीएस डिग्री हेल्पिंग यू, इट्स बिकॉज
Hmm.
आई अंडरस्टैंड better the
Yeah.
requirements of the
Yeah.
doctor as well as the patient, having been on both sides. I
Hmm.
understand better कि अच्छा, a field like gynecology maybe has a different organizational requirement as compared to the
Very
emergency
true.
department, which
Very
has a
true.
different requirement for the pediatric department. क्योंकि
So
मैंने
true.
काम किया है, मुझे know-how है, I understand how all of these things are linked, right? And
Hmm.
because I have knowledge about the physiology of the human body also, तो I also understand कि कौन सी फील्ड की क्या, अगर हॉस्पिटल सेटअप ही करना है तो हाउ इट शुड बी मेड टू
Yes.
यू नो ease, आप कह सकते हैं, for ease of access, for all of those things. So if I hadn't gone through, hadn't had my degree, I wouldn't have had the insight to be able to
Yes,
understand this.
exactly.
कोई बाहर वाला नहीं अंडरस्टैंड कर सकता. वही बात है
Exactly.
ना, जिस पे गुजरती है उसको पता होता है. So
हाँ.
since I've been through this, then I understand it. So for a
Hmm.
while I would talk about, try and explain it, but then I just stopped.
Hmm.
I was like, it's fine. Up
I'll let my
in the
work
end,
show
I was
it.
just like, I'm happy. Aren't you happy? I'm happy. That's it. I'm doing well in life. I'm happy. So you should be happy for me. Because I guess I've always been the sort of person who has never really cared about what other people say. I don't know if it's a good thing or a bad thing, but
It's a
that's
good
how it
thing,
is.
definitely.
Because I'm just like, I know if I know in my heart that I'm doing something right, then okay, fine, I'll just do it. अगर मुझे कुछ
Hmm.
validation चाहिए होती है तो, and again, this is a completely personal belief. Everybody has their own beliefs, and mine was that if I needed validation, I would do istikhara and I'd be fine then.
Hmm.
Whatever I would be, the path I'm taking, I just take that.
Hmm.
I've never spent more than 2 seconds maybe thinking over what people are gonna say. And in the end, I stopped
Yeah.
justifying it. And now, Alhamdulillah, at the place that I am, I don't think anybody asks any questions anymore.
Alhamdulillah, Alhamdulillah. I'm so happy to know that. And I'm also so, again, relieved to know that someone who has worked in the system, who knows the inside out of, the shortcomings of the healthcare system, is doing this. Because वही वाली बात एक जिसने एमबीए का किया हुआ है सिंपल, या जिसने जो बिजनेस साइड से एसोसिएटेड है, या जो है मैनेजमेंट साइड से ही सिर्फ एसोसिएटेड है, वो सिर्फ एक हद तक ही समझ सकते हैं कि डॉक्टर्स की सिस्टम में, या जो डॉक्टर पेशेंट इंटरेक्शन है, या इस पूरे हेल्थ केयर सिस्टम में क्या क्या इशू है, वो सिर्फ एक हद तक समझ सकते हैं, उससे ज़्यादा नहीं समझ सकते। बिकॉज अगेन वही चीज़ कि व्हेन दे हैव नॉट बीन इन दोज शूज़, तो वो कैसे समझेंगे। बट फॉर समवन, बिकॉज यू हैव बीन समवन हु हैज़ बीन इन दोज शूज़, हु हैव वॉक्ड इन दोज शूज़, एंड नाउ यू वांट टू डू समथिंग अबाउट bringing a change that comes from, not just inside out, but outside in as well. You're working on something that is, how would I say, that is comprehensive, that is targeting the different factions or the different areas that are going to influence all of the other things. So I'm so glad that, you cared enough about that, and you found your path through your different, abilities, be it your work at Walking Thoughts, be it your work at Rafeda, and now your work as a teacher, as a lecturer as well. I'm so glad that you found all of this, and you made your. I won't just say that you found all of this, because truth is you made your way through it all. You worked through the system. You understood the realities. You understood uh, the issues that were being faced by everyone, by you specifically, and you worked on that. I'm so, so, so happy to hear all of that. And like I said, I can go on and on this. We can maybe, catch up again in some another
I was gonna
episode
say
of
that.
this.
I was gonna
Yes,
say
because there's still so much to be talked about. There's still so much to be explored and to be discussed, that we will definitely be needing another episode. And I'm again, one thing that I would like to say, जो आपने वो बात की ना कि when people ask you कि अच्छा when you tell them that you are teaching doctors how to be doctors, and they give you this blank look, and then you explain to them कि डॉक्टर जहाँ काम कर रहे हैं उस सिस्टम के लिए भी तो कुछ होना ज़रूरी है। That reminds me, or that made me think कि that is such an issue for everyone, because even for people who are outside of medicine, they're always, in your family, in your neighbors and everyone, they will be talking about this कि यार हम फलाना जगह गए थे, वहाँ पे डॉक्टर ने ऐसे दिखा था, वहाँ पे ऐसे नहीं किया था, और
हाँ
वहाँ पे सिस्टम नहीं था, वहाँ पे हमें कोई देखने वाला नहीं था, हम इमरजेंसी में गए थे और वहाँ पे उनके पास चीज़ें नहीं थी, they will be, because that is such a close experience, and it is, it is a worry of everyone, because at some point in your life you will have to go to a doctor, you will have to approach a hospital, you will be interacting with a healthcare worker. So it is your, I would say, headache as well. It is the concern of everyone. Heaven Healthcare is for everyone, it is the concern of everyone, and that includes not just the healthcare professionals. So I think we should be wrapping it up, even though I want to go on with this, but we will be wrapping this up. And thank you so much again, Dr. Arfa, for taking out the time, for sharing your insights, for sharing your thoughts. It was so refreshing to hear all of that. And I'm really very happy that you're working on this, and you're working with all of that. And you are, Alhamdulillah, mashallah, being very good at what you're doing. So I wish you all the best. I wish you all the success. And may Allah Ta'ala keep opening the paths for you to make lives better for everyone, through your work, inshallah. And I wish you all the best. Thank you so much.
Thank you so much for having me. It was a pleasure to be here to talk about something so close to my heart, to talk about something that I've literally invested a lot of years
Hmm.
in, a lot of hard work. It definitely has not been easy. It's not easy to stand up to the norms and challenge it and go against the status quo. So, very happy to be here, and I'm really glad to see the good work you guys are doing in raising awareness, especially about all the difficulties women face in medicine and the new things they come up with. So I wish
Hmm.
you all the best also. And I would definitely want to catch up after this and look
For sure.
forward to more ways in which, maybe we can work together. So all the best
Yes.
to you guys also. And thank you so much once again.
Thank you so much. Thank you so much once again. And again, we wish you all the best. All right. So that was yet another episode of Women with Steths, a podcast that is dedicated to discussing and honoring women who are changing medicine and healthcare for the better. I hope you had as much fun as I did in this episode, and we're going to see you in the next one. This is your host, Dr. Amara Jamil, signing off. Bye. Hafiz.